If your child acts impulsively, has difficulty paying attention, and can't sit still, it could be a sign of attention deficit hyperactivity disorder. Well, now some doctors are using a drug-free therapy to ease those symptoms. CBS 2 HealthWatch reporter Paul Muniz joins us with details. Paul.
Angela, at least 4 out of every 100 children have ADHD. In recent years, there's been a steep increase in the number of kids being treated with drugs. But many parents are looking for another option, and something called neurotherapy is helping some children kick the medication habit. When Jim and Janet Herlihy first recognized behavioral problems with their oldest son, Michael, they grew very concerned.
He couldn't stay with something. He was distractible. Frustration level was very high. And he was angry. He was very angry, and he was aggressive.
8-year-old Michael was diagnosed with depression and put on Prozac. The medicine helped, but his parents did not like the idea of him being on it long term. They turned to a company that offers EEG neurofeedback for ADHD, learning disabilities, and behavioral problems. In a series of about 40 one-hour-long sessions, Michael played video games using only his brain to control the computer, not a mouse. An electrode attached to his head tracked his brain activity and turned it into action on the screen. Domenic Greco is executive director of Neurodynamics, one of about a half-dozen companies that develop such technology, which has been used this way for about a decade.
Children with attention deficit, for instance, produce an excessive amount of what we call slow-wave activity in the brain. That slow-wave activity is conducive to inattention, distractibility, daydreaming.
Through practice and feedback, Michael conditioned his brain to produce faster waves, translating what he learned here into the classroom. Neurotherapy advocates say the success rate is 70 to 80%. Greco says at least half of the patients on his program go off their medication completely, but there are skeptics who say the studies on the therapy are too small, with no large clinical trials and no double-blind placebo studies to compare neurotherapy to no treatment at all. Treatment usually lasts 4 to 6 months. After therapy, Michael is more focused now and gradually reduced his Prozac until he was off it completely after 1 year.
It really made a believer out of me that the technique is effective, and, I started out skeptical.
About 12 to 1,500 centers across the country use this treatment, but it is important to keep in mind neurotherapy is not a cure but a treatment tool. In some children it doesn't work, in others using a combination of drugs and feedback can produce the best result. For more information on neurotherapy, you can log on to the CBS 2 Information Network website at cbsnewyork.com. Michael and Angela, back to you.